Hello everyone. Today we are going to discuss about the most common spine problem related topic, that is slip disc. Yes, you must be aware of this term. So before that, first we will know in short about our human spine. Our human spine contains 33 vertebral bodies, 23 intervertebral discs and 24 motion segments. So what is this intervertebral disc? Disc is a structure like tire which is lying outside and an inside jelly like structure called nucleus pulposus, and this outer structure is known as annulus fibrosus. Where are they located? They are located in between the two vertebral bodies, which lies just in front of our spinal cord and spinal nerve roots. So what is the function of this intervertebral disc? So disc mainly acts as a shock absorber between the it helps in transmission of the human weight, the body load. It helps us being flexible, of course, which is aided by the facet joints which are lying behind of the spinal cord. So where do this disc get its nutrition from? It don't has its own blood supply. It gets mainly its nutrition from the end plates which are lying adjacent to it, that is from the intervertebral bodies. Okay, so now coming to the slip disc. What is slip disc? The disc which has slipped. Yeah, so it's a layman term. Actually in medical term we call it as a disc prolapse, where the outer annulus is just bulged and causing pressure on the behind lying spinal cord and its nerve roots, or there can be tear of this outer annulus and the inside jelly like structure which may come out. In that condition we call it as disc extrusion, and once the inside structure, once it is detached from its parent disc and lying free in the spinal canal causing compression on the nerve roots, we call it as sequestration. So what are the symptoms of it? The disc prolapse and disc rupture usually causes pressure on the nerves, and it causes mainly severe low back pain. More than back pain, you have the radicular symptoms. The radicular symptoms such as shooting pain going down, if it in the cervical area, shooting pain going down from the neck to the upper limb, till your both hands, and if it is in the lumbar area, the pain shoots down to either or both legs, that we call as sciatica. In medical term we call it as radiculitis or radiculopathy. So common symptoms are pain and radiculitis, and few patients may even feel loss of sensation or numbness in the affected limbs. With that, few may have weakness in specific group of muscles. In very few patients they may feel numbness total in their lower limbs. With that, loss of control over maturation and bowel habits. So how to diagnose this problem? The most common mode of diagnosis is clinical examination, and the accurate method is the MRI scan of the affected spine. So MRI scan shows the condition of the disc, the level of the disc affected, the severity of the pressure on the nerves and the location of the pressure. So don't worry, not all patients with slip disc or disc prolapse need surgery. Proper assessment of the patient clinically, correlating it with the MRI findings is very much important. A short course of medications and activity modification, with that using lumbosacral belt, can help curing this problem. Majority of the patients can be treated it without surgery. Yeah, you heard me right. Majority of the spine disc problems can be treated conservatively, that is without surgery. So which patient of this disc prolapse or slip disc needs surgery? Only the patients where the conservative line of management fails after 4 weeks, patient developing sudden weakness in the legs or numbness in the legs or hands, patient having the cauda equina syndrome like loss of bowel and bladder control, both limb weakness, etc. So proper examination and proper decision making is very important in slip disc. So do not hesitate to consult a specialist for this problem, where it can be treated well if diagnosed initially without surgery. Okay friends, so in our next presentation we will be discussing about what are the types of surgeries done in slip disc, what are the latest trends and tricks and methods for surgical treatment of slip disc. Until then, take care. Thank you.